Well, good afternoon, everyone. Happy New Year. Dr. Ezike has joined me today to help address the progress of the first 3 weeks of the vaccination process here in Illinois and what the next phase of access will look like for our 12.7 million residents. As of last night, approximately 344,525 total doses of the Pfizer and Moderna vaccines have been delivered to Illinois outside of the city of Chicago. In addition, 114,075 doses from Illinois' allotment have been set aside for the federal government's long-term care vaccination program, again outside of the city of Chicago, operated by CVS and Walgreens. Illinois as a whole has administered approximately 207,106 total vaccine doses to date, including yesterday's first round of second doses for the early December first dose recipients. That number also includes vaccinations through the federal long-term care vaccination program, whose partners only started vaccinating in Illinois on December 28th. Nearly 2 weeks after our first state-delivered vaccinations. These first vaccinations have taken place following the Phase 1A recommendations of the CDC's national recommendations with input from IDPH. That first phase includes healthcare workers and nursing homes and long-term care facility residents and staff, which we now approximate as 850,000 eligible Illinoisans. Up to now, this vaccine has only been offered to a very specific group of people at very specific locations in staggered proportions because hospitals and nursing homes have been concerned about too many of their staff receiving the vaccine on any given shift. Because of this and because of the early federal supply issues, so far approximately 1/3 of our healthcare workforce outside of Chicago has received the vaccine. IDPH continues to work with local health officials to ensure the rapid administration of these vaccines to all members of Phase 1A who consent. I had hoped to see an increase in the number of vaccines delivered to us from the federal government after I announced federal delivery reductions to you in December. The delivery of vaccine has remained at a lower pace than expected. Illinois has now allotted approximately 120,000 doses per week, 60,000 each of Moderna and Pfizer. From that number, the federal government pulls out the long-term care allotments. We have updated our early January planning for Illinois according to this lower than expected federal delivery schedule. The good news is that the incoming Biden administration has pledged to invoke the Defense Production Act so that we expect the vaccine production will grow significantly over the coming month. Despite the early slowdown of federal deliveries and with high hopes for increased vaccine availability going forward, today I want to address the specifics of what the next stage, Phase 1B, will look like in our state when we have substantially completed Phase 1A. As a reminder, the only reason that we must phase in this rollout of the vaccine is the scarcity of its availability. The need to prioritize is a function of that. Last month, the CDC's Advisory Committee on Immunization Practices, ACIP, met to provide further guidance on upcoming phases of vaccinations. By design of the federal government, the actual administration of vaccinations has been left to states and to cities, and the ACIP guidance is intended as a well-thought-out set of recommendations that states can then tweak to best serve their unique populations or unique challenges. I want to commend ACIP for its efforts, which have been very important in our process. None of the decisions that ACIP made were easy, and none that fall to the states are easy. Broadly, ACIP's recommendations are focused very properly on preventing illness, saving lives, and restoring the functions of society, which is why their guidance on Phase 1B has included, importantly, seniors 75 and over and frontline essential workers. And I'll dive into how the CDC defines that term in just a moment. ACIP's guidance serves as the foundational blueprint for Illinois' Phase 1B plan, with one key adjustment. Here in Illinois, we are more strongly pursuing equity in the distribution of our vaccinations. Let me begin by talking about ACIP's recommendation that Phase 1B include only seniors who are 75 years old or up. I believe strongly that we ought to protect more of our seniors earlier than ACIP has recommended. For the last 10 months, we have seen the fundamental vulnerability to COVID-19 of the entire population of our seniors, not just those 75 and over. And importantly, the average age of death from COVID-19 is much lower than 75 for Black and Latino Illinoisans. While the average white person in Illinois who died from COVID-19 passed away at age 81, the average age of COVID-related death for Black Illinoisans is 72, and it's 68 for Hispanic Illinoisans. For people of color, multi-generational institutional racism in the provision of healthcare has reduced access to care, caused higher rates of environmental and social risk, and increased comorbidities. I believe our exit plan for this pandemic must, on balance, overcome structural inequalities that have allowed COVID-19 to rage through our most vulnerable communities. Lowering our minimum age for vaccinations in Phase 1B is one critical component in addressing that. So the one area where we are diverging from the ACIP recommendations is this. In Illinois, if you are 65 and over, you can get vaccinated in Phase 1B. We've adopted the rest of ACIP's Phase 1B recommendations, which is mostly focused on frontline workers, a group that in many of these industries is disproportionately made up of people of color. The ACIP term frontline essential worker is really focused on those individuals who carry a higher risk of COVID-19 exposure, in large part because their work duties can't be performed remotely. So they spend more time in proximity to other coworkers or members of the public. The CDC estimates about 30 million Americans are frontline essential workers. That includes first responders like firefighters and police officers, educators like teachers, support staff, and childcare workers, people in essential industries like the Postal Service, manufacturing and distribution, public transit, food and agriculture, grocery stores, and congregate facilities. All in all, Phase 1B totals approximately 3.2 million people throughout the state of Illinois. As we enter this next phase of vaccinations, I have directed my team to utilize every available state resource, a massive infrastructure and logistics effort, to get this vaccine out to as many people as possible, as quickly as possible. A vital component of that is our extraordinary Illinois National Guard, who orchestrated the development of our robust public COVID-19 testing infrastructure early on in the pandemic. Under General Richard Neely's direction, the Guard will bring their expertise, their precision, and their efficiency to standing up mass vaccination sites across the state. We're also actively increasing the number of providers registered to administer vaccinations so that we can implement widespread and equitable availability as more and more vaccines are delivered to our state. As we do this, my administration has also issued additional non-discrimination guidance to ensure vulnerable and historically marginalized communities receive equitable, informed access to these vaccines. Our goal is to expand vaccination infrastructure right now, including especially in communities that have been disproportionately impacted, to move these vaccines through our state at an even faster pace as we see an increase in federal deliveries. In summary, once we've substantially completed vaccinations of healthcare workers and long-term care facilities, and as federal vaccine deliveries increase, we will move into Phase 1B, which will cover everyone in Illinois 65 and over, plus frontline workers. Our IDPH team continues to review ACIP's recommendations for Phase 1C, and Dr. Ezike and I will provide a further update on that sometime over the next few weeks. Finally, before I turn it over to Dr. Ezike, I want to make an announcement regarding the Tier 3 mitigations currently in effect across the entire state. Since November 30th, I have maintained, at the advice of Dr. Fauci, of Dr. Ezike, of IDPH, and other infectious disease experts, that it would be unwise to downgrade any region from our current Tier 3 mitigations while in the holiday season, when people were particularly prone to gather in multifamily groups and do it without masks, the thing that could deliver the worrisome surge upon a surge. I'm incredibly grateful to the people of Illinois for making the difficult choice to take extra caution around Thanksgiving. Illinois did not experience the post-Thanksgiving uptick at a rate that plagued most of the rest of the country. And we're watching closely in this incubation period post-Christmas and New Year's. I'm cautiously optimistic, as there are some early signs indicating that some regions have made real progress and won't reverse that progress this week or next. So on January 15th, exactly one incubation period from New Year's Day, any region that has met the metrics for a reduction of mitigations will be able to move out of Tier 3 of our mitigation plan. My prayer for the new year is that everyone stays healthy and all of our regions continue to move in the right direction. And I ask all Illinoisans to join me in making that possible by wearing a mask and keeping your distance.